In this video, I will address the workflow related to dealing with deficiencies. I would like to focus your attention on the workload, both button and workload pane when you first go into WebAcute, as well as the sign button. We'll first start with the functionality you will find under sign. This has to do with face sheet deficiencies. You will have a list of all of the face sheet deficiencies when you click on the sign button. When you go into one of these deficiencies, it will show you the face sheet, and in gray it will show you the missing items. Now, by default, initially it will open the page in full page view, and to be honest, this is probably the easiest way to look at it. If you would like to see it in page width, so you can scroll through it and see a bit more detail, you can set it to page width using these controls. And if you want it to open in page width all the time, you can set it to default under options. Again, personally, I prefer the fit all setting for this function in MEDITECH. To go through these, you have to click on sign. When you click on sign, it will gray the deficiency you need to address. Click sign again, and it will open up the field where you would need to enter text in the case of a text entry deficiency, or sign off the face sheet if this deficiency just had to do with the signature. To enter text, simply click into the field and go ahead and enter. Now, unlike our experience with Horizon Physician Portal, you can enter essentially an unlimited amount of text into this box. However, it will get cut off into the chart. So please pay attention and make sure not to enter too much text that will cut off and not show on the face sheet. Once you're done with the text, you will click Apply Changes. If you would like to display the text here in large font, normal font, small font, etc., you can go through these buttons. When you apply changes, it will put the text into the box. It will show who signed it and the date and time of the signature. Once you apply changes, click OK. This will take you to the next box. Click sign. Again, enter text. Apply changes. Click OK, and so on and so forth. Deficiencies you have reviewed will get a green tick box in the list. This doesn't necessarily mean that the deficiency is complete. It just denotes the deficiencies you've looked at on this occasion. Now, let me show you a deficiency which is just missing a signature. You can see here it says to be electronically signed by Urif-MD. To sign it, click on sign, and voila, it's now electronically signed. Click submit, and to finalize it, enter PIN. Next, I would like to focus on the workload function. Again, you can deal with workload from the pane directly over here, or by clicking on the workload button, bring yourself to a full page view of the workload. There are a number of items listed in workflow in test. Once we are live, we will have incomplete records. These are essentially your dictation deficiencies. At this time, we will not see consults, letters, results, but we will see other. And other essentially are messages from other healthcare providers. You can go through the messages and enter text to respond. This is covered elsewhere in the videos. For now, I would like to focus on the dictation deficiencies. When you open the list, all of these are bolded. Once you go through them, the text will change and the bold text will go away. When you go into any of these deficiencies, you will see what the deficiency is about. It clearly identifies it as a dictate final note deficiency. Click the text box and save once you have created the note using dictation or electronic documentation in MEDITECH. Let me dive into a bit more detail. When you click on the down arrow next to dictate final note, you can also reject the deficiency. Select a reason. For instance, this may be completed, or perhaps this really is somebody else's deficiency. And you can enter the comment if, for instance, the deficiency should be completed by a different provider. Let me enter Dr. Verma into this one. Now, if you are going through your deficiencies and you would like to create a note either by dictating it or going through electronic documentation, while you're in workload, you can click on chart. This will open the chart view. You can go through the chart, again, provider notes and other sections in the chart as you are dictating the deficiency. You can also go to document and create the missing document using electronic documentation. Remember, all of the pages you're working with in MEDITECH are still available to you in their last current state. To get back to workload, simply click on Return to Workload. This brings you back to the deficiency. Once you have created the document, either electronically or by dictating it, you can acknowledge, click Save, and the deficiency is gone.